So the main issues that older people face these days, not only in the pandemic situation, is coping on their own, or whether it's with the family. So during this time, they can go through uh, various mental health problems, which could be just for few days or weeks, or it could well go into a full blown disorder. The symptoms that they commonly come with is anxiety, sleep problems, phobias or panic, normal fear, whether it is of fear about the physical health, fear about the future, worry about the future, death, dying, and things like that. Uh, Depression is very common. Some of them also have drug and alcohol problems. So over-the-counter use of sleeping pills is very common. So that's increasing problem that we are encountering in our clinical practice. As regards the facts and figures, now we all know that the life expectancy of people is increased vastly. So people are living longer, which means that they have higher chance of not only mental health problems but also physical health problems, and they both are very very closely interrelated. Health the statistics, the WHO says that 20% of older people or senior citizens can have some mental health problem, and that's a huge number. And what stands out in this is mainly anxiety and depression.
Aging process. Now, aging process itself should, has always been unfortunately branded. I'm not saying it is true. I don't believe it at all. As a slow and unproductive sort of process in which, as you get older, the contribution might reduce. And this is absolutely something which I don't believe in at all. And most older people should not. So it's not about being elderly these days. It's about being welderly. So as you actually get older, you're actually going to be well. But what links this is whatever WHO says, whatever health is defined. Health is defined as a state of physical, mental, and social well-being. There's a reason these three factors are there. It's never said only mentally fit. It's never said it's only physically fit. It's never said it's only socially fit. So all these factors, once they come together, is when an older person will feel actually at peace. But that does not mean putting the problems under the table. The problems are there. Mental health problems are there. And the biggest problem is, do not brand it to age. Myths. This is where the myths come in. All older people will have dementia. All older people will be depressed. All older people can't learn. So that is the problem. So that itself sort of generates that negativity. And then older people are like, oh my God, maybe this is the way I'm supposed to be, which is not the reason, which is not the way it actually is. Now everybody wants to learn. Sometimes society ourselves are responsible to create that negativity. I'll quote an example. An older person would love to learn music. What's wrong? But when they go into a class with younger people, and this is a quote example I'm quoting, uh, the older person's family themselves asked, "Is Umar mein, do you want to become Lata Mangeshkar?" So why? I mean, that's a totally invalid question. So productivity never goes. So I would say that problems exist. Depression is very common, as sir said, but commonly not detected. That is also a problem, because nobody comes up to us and says, no, I'll be depressed. As a person who's taking care of older people, tuberculosis will also produce loss of appetite, weakness, but depression will also produce the same thing. So for me, it's about to pick it up and help that older person to delineate whether it's actually only the physical problem or it's the entire problem. And older people always, I would say, senior citizens is a nice word. Geriatrics, of course, is the word which not everybody understands. But another thing that contributes to the mental health problem from a caregiver's point of view, I would say, is you should never brand an older person as a child, because they are not. आप बच्चों जैसे behave कर रहे हैं. Are you, as I mean, you are behaving like a child? No, that is not. This is an older person who has wealth of experience, and not age. Age is a number. So you have to respect them that way. You cannot say, I mean, there are a lot of people who say you have to treat them similarly as a child. No, a child, might not always have their thought process, because you are formulating that thought process. An older adult has a thought process, so you need to help in inculcating that and create positive energy.
Risk factors, and this is these are sort of the general risk factors, and it can be specific to every individual, like hereditary can play a factor. But the general risk factors is the physical health. Physical health illnesses like diabetes, blood pressure, or Parkinson's, or say undergone, cancer therapy and things like that. They can also have an impact on the mental health. Suppose if there are mobility issues, you constantly have this, mental mindset that I am going to be dependent, which is not the case. Not every person will have those problems, but this is another risk factor. Then social deprivation, or living alone, or loss of spouse, bereavement. So we know that that's a very sort of a risk factor for certain mental illnesses, for example, anxiety or depression. So that having had prolonged hospital admission, or treatment for physical illness, there are certain specific mental illnesses which commonly occur in this population. Say, for example, having undergone a bypass surgery, or a complicated operation for, say, cancer of the prostate gland in men, or similarly breast cancer, or any other cancer treatment. So these are also certain illnesses where we know for a fact that physical health problems can give rise to mental illnesses or disorders. So the red flag or the common signs that we do advise caregivers of family members or spouse to look for is, say, not taking interest in their self-care, for example. So that includes changes in the appetite, or not grooming themselves or looking after themselves. You need coaxing them or persuasion for having a shower, taking bath, or in fact taking their medications. Physical health problems, they are important to take their blood pressure, diabetes medication, which will have a knock-on effect on the physical health. So some of these are the under the rubric of self-care, or neglecting themselves. Or some people indulge in excessive consumption of alcohol, so that can also happen in depression. Then not interacting so much with family members or friends. So for example, if an active person has been very regular at say a cards group, or a bridge club, and they've not been going, or spending time excessively brooding about their outlook, or thinking negatively about the future, crying on their own, uh, being irritable, or having suicidal thoughts. That's also very important. We know that you know suicidal attempts are also high in this age group. uh, so these are some of the sort of the red flag signs. And in extreme cases, then they may develop what we call as psychotic, which is feeling very paranoid, or in fact having hallucinations. So that can also happen if it is undiagnosed and untreated for a considerable period of time.
It helps in actually expressing. I mean, imagine the pandemic without no social interaction. I mean, the biggest problem of COVID is not the disease. The biggest problem of the COVID was it created the social gap. Why are we worried about it? Because you can't meet people, you can't touch people, hugging is out. I mean, so that's what I'm saying. These are all things which actually generate emotions, generate empathy, generate grace. So that's why ultimately whatever platform we have now, social interaction is actually the best way of it. And positivity is something starts from us. So you would want to be positive on your own, but if you're not able to, draw inspiration. Your life is an inspiration. Don't tell me you have not overcome problems. I mean, I at my age, I actually learn from all my patients, and sir will vouch for it. Even Dr. Bangar will vouch for it. We learn from the older people, their
Every time.
experiences. So I think that's the way. That's the way we should actually look into it. Of course, Dr. Bangar would also weigh in.
a psychological point of view, we know that social and personal interaction is part of the treatment. You know, uh, it is what we call as biopsychosocial. So biological means medication, psychological means talking therapies and counseling, and social is all these social interactions. We have these group settings, or whether we have one-to-one settings. So all this is a crucial aspect, and I cannot overemphasize this, that how important it is, that only a tablet is not going to get you better. It is all these three, and that's why we call it as a holistic or a team working, what Dr. Prem was alluding to earlier. So we have this art therapy, crafts or dance, music. So these are all part of the therapy. There is growing evidence that how significant this is. It's not just merely sitting in a group chit chatting, but it is also the social aspect, the social interaction. And we have seen that people who are not getting better only with medication, or who are attending day centers, they have a better prognosis or better outcome, and they stay well for longer period of time than somebody who's a little bit socially isolated.
Is there any example that you would like to
Honest in our clinical practice. So whether it is the social interaction, the caregiver who is there with the person almost 24/7. So even the social interaction with the caregivers, probably the person who's needing the caregiver support sees more of this caregiver rather than the son or the daughter, the family member. So even a consistent approach from the caregiver, and we train the caregivers every time that what approach they should uh, include in their daily caregiving, what like the do's and don'ts. So it is sort of a everyday matter for them, what they should say, how they should approach. Say for example, if somebody's got mobility issues and stuff like that. It's a huge role the caregiver plays actually, from the social aspect also. Just a number. I think it's not a cliche statement, but we will say that every time that it is just a number. So it is, once you start feeling sad, depressed in your mind, then you're defeated. So then you're bound to get it. If you have a positive mindset, and it's not going to come straight away, it will come with practice, with some kind of help with the therapist as well, with counseling. So once you are positive, you do, and you can challenge younger people also. As we know, there are so many examples of people who have succeeded in doing tasks. For example, I think recently with the Fit India movement, uh, Milind Soman's mother was into limelight, in her 80s, how many push-ups she can do, and she can do probably more than the son, Milind Soman, or probably as many. So it is also the mindset of the person. It is that that attitude, that gutsy attitude, which yes, I can do it, or I am willing to try. So when we have this learning from the Sudoku or crosswords, it is it is preserving those mental health, uh, or the structures of the brain, also slowing down their degeneration as well. So you're keeping your brain sharp every day. You're challenging with a medium to hard Sudoku and stuff like that. So these are also protective, and they do come under the rubrum of cognitive behavior or cognitive stimulation therapy. Actually, CST it is called. So these are the activities that they can participate in. And physical health, any chores in the house, once you remain active, you have this routine. Nowadays COVID has taught us how you can multitask. You can wash your utensils, you can dry your clothes also, and clean the floor and everything. So all these little things also help, because any kind of physical exercise has a beneficial effect on the mental health as well.
Right.
Prem?
Why we should, I mean, the contribution of an older person to a home is actually much more than, I mean, I'm not even talking about now. I would try to give the example of my own home. I'm actually a doctor because I was highly motivated by my grandfather, and I was obviously very close to him. uh, so the thing is, the values they actually give to younger people. So that is one. So that is one of the biggest contribution. That itself is actually an exercise. I mean, it's not an exercise, it's a therapy in a way. It's not that we are saying that it's something which is done, but it's now naturally done. And that is something which gives them so much happiness, especially. I mean, it's so simple. I would say for an older adult, their grandchild is like, forget it, he can do no wrong, or she can do no wrong. So that is there. So that creates a lot of positive energy. Then exercises physically is very important. That's why we said now it's actually said sitting sedentary is the new smoking. So no, none of the older people should actually sit. I mean, most people in this group are already fit, so I don't need to tell them to do, but I would just tell you that you have to make sure that at home also, however small or however big your space is, try to keep continue doing your exercises, your physical movements, because physical stimulation always helps mental, and vice versa. If you're mentally down, you have no interest in your physical part. Why should I take my medications? Why should I take what am I living for? The other way as well. If you're physically down, then you get mentally down. So that's why that physical fitness, physical exercise is very important. Now, as far as daily shows are concerned, very important. That's why as caregivers, again, never stop an older person who loves to cook. We have servants. I am there. I mean, a lot of people are like, I am there. The child also. So why do you have to go? But cooking is actually such a complex thing. It helps the person in making a joy of life. Of course, they have been doing it for years. So don't stop them from doing it. And it helps mental health. So now what we are saying is, now a lot of older adults, which I have been in, especially during this pandemic time, they are trying to create their own dishes. They're more than happy of doing it. So they are experimenting. So that's what we want from older adults. So this is also an exercise. So it all really sort of ultimately stimulates. So it has to be a mixture. Let me be very frank. It has to be physical exercise. It has to be crafts, anything. You are not in this for getting an award. Do whatever you want to do, whether it's art, whether it's music. Try to go into that peace mode. Now I call it peace mode or Zen mode, wherein you go into where nothing matters and it's only you. So that particular piece, it could be anything. It could be just closing your eyes, thinking about memories, or it could be as good as thinking of a poem that you loved, a music, a dialogue that you loved, or some instance. Or it could be just nothing. Some people just want to be. So that me time, people keep talking about that me time. Everybody needs it. So you need to go into that, see what is your me time, and that exercise also will help you in generating more and more sort of positive energy. And ultimately, it's all interlinked, physical and mental. And again, reiterating, physical, mental, and social will always make you a more better mentally forward person as compared to somebody who wants to not engage at all. There is something known as independence. There is something known as quality of life. For me, that is the most important thing as far as an older adult is concerned. An older adult suddenly realizes, oh my God, I'm actually getting dependent. No, they still handle it. We are there to help you handle it. That's why never think because you are having a walker, you're having a stick, you're having an hearing aid, or you're having a visual aid. They don't make you weak. They make you stronger. They are actually an extended arm in your body. So that's what you should always see. So that is the positive way of seeing that you are not dependent on them. They are making sure that you are independent. So that's how you should sort of see. So physical activity will naturally come at levels. So you should know how immobile you are, what you can do and what you cannot do. That is also, I think, very important. That's why multidisciplinary, we always try to get in a physiotherapist as well, just to see what is there. Some people might have muscle mass less, some people might have muscle mass more. What is the reason why that older adult is not trying to walk? Is it a fear of fall? Is it a fall, near fall, which they didn't tell us about? So those things are something which are very important to assess. Is this the shoe? Sometimes it's just the shoe or the chappal they are wearing. It's just slipping again and again, and they are actually having difficulty in that. So I think with older adults, noticing the small things matter a lot, because making those small changes actually create a distinct effect. Another thing that makes them lose quality of life, we might give you the best food possible, but do they have dentures which are not painful? Do they have teeth? So that also becomes very, very important in assessing. So ultimately, that's how we try to assess. And we need to see that activity, inactivity is reduced. Mental activity, mental exercise is as important as physical exercise. So that's what I would like to sort of say, that be physically fit, but know your limitations.
Is that activities which you never done in your life, like for example Dr. Prem suggested about dance or music, so these also increase the brain areas or increase the brain reserve, the cognitive reserve. They make it more flexible, the brain cells and stuff like that. And that is the recent research saying that you should learn new whether language, new skills, or some of them have gone even further ahead, saying that start using your non-dominant hand. For example, if you're a right-handed person, you obviously shave, brush with your right hand, but try your left hand also. So that's going to increase the flexibility, which is not going to come soon. You need to practice all of these. So these are various aspects of the you know cognitive stimulation therapy. There's a lot of emphasis because there are not many medication which are going to cure these. We are talking especially about dementia here. So all these are things which will keep your brain active, and it will slow down the deterioration of the illness. That if you're going from A to B, say to your son or daughter's house, so one specific route, so try another route. Don't rely on the Google Maps and stuff like that. So yes, that's very very useful. Blood pressure or diabetes, you do not hesitate to see a doctor or discuss your health issues. But when you talk about a mental health issue, it's like everybody is going to you know uh, look at you as if you've seen a psychiatrist, so that means something must be hugely wrong with you. That's the mindset of our society, unfortunately. But I must add that this mindset is changing. The stigma is easing a bit. The taboo is being addressed, and thanks to the social media, various programs that you people run, I think that's making a huge change.
Mental health is something which has been already been taught at all ages, but it should be streamlined for everybody. And younger people should more know about older people also, because everybody should think not that because I have a grandfather or a grandmother I need to know about the mental health. No, because you are going to get old, so you should prepare for your old age, not necessarily think that only because I have somebody old that's why I need to know. So more and more people are sort of learning. The attitude is definitely sort of changing, but my only thing is, if you have an issue, reach out. A lot of times that reaching out does not happen, not because purely because they do not want to reach out, purely because they are not able to convince themselves that I, at this age, 95 years, I have seen life, I have grown, I have had kids, I have had successful businesses. Why the hell will I actually ever have something known as a negative mindset and depression? No, this is all nonsense. So, con, con, basically confronting yourself and asking yourself whether you need help or not, that is something which should come into the forefront. And myths, like especially with aging, there are just too many myths like, no, all old people have depression, it's a part of aging. No, all old people have forgetfulness. Absolutely not. They can give a run of for the money for younger people. So remember, it's always medication plus changes in your way of doing things that help. Medications are no magic bullets. Medications only help in inculcating or helping you out in trying to change things. So try to eat your food at good times. Try to have a routine, never extend it too much. You have a discipline, you want to eat at this time, try to eat it. It varies according to your diseases. If you're a diabetic, make sure you eat frequently. Never the sugar should go suddenly low. if you don't tolerate things, you should know it, because by this age you know. But yeah, we always have that naughty bone in us. Is any age that ki kha lete hain, we'll eat and then we'll see. So that is when the medications can sort of come in and you can. So in between, you say no, there is always a cheat day, but that is okay. But consistently, I feel you should sort of, if you do things properly as far as diet is concerned, and eating at proper times, I think of course gastric problems can be handled. But if you are having severe problems, do not neglect them. Try to go to your doctor, whoever the healthcare provider is, and if you need testing, we would obviously do it. Depending on what we find, we obviously would want a gastroenterologist, which is something much later. Retirement homes and this is concerned, I think it's autonomy. It is entirely your choice. If you feel that you would want to actually move out, you have a life, you have lived a life where you have taken care of everybody, you have done all your duties. I never believe in the second innings thing. I just say that this is the innings you want to play. So whether you call it second, third, fourth, it doesn't matter. You want to live your life, concentrate on yourself. So moving out socially is always seen as, oh my God, maybe there is a problem with the children. No, that's not the way. It's like everybody giving each other space. I mean, they decide.
Memory games are one that you can play. So puzzles, there are puzzles, specific puzzles, brain exercises, in the market which are available now, and online. You have various apps. So these really help. Uh, there are certain techniques. For example, one is called chunking. So you can learn a longer thing in chunks. Say, for example, a phone number, a 10-digit phone number. If you can chunk it into, say, 3 or 4 digits together, you'll learn that number, or you'll remember that number easily, as opposed to all 10 digits at once. So a number like, say, for example, 7777 009500. So it's a 10-digit number, but it's easy to remember rather than another number 982034126. Now, why is that easy? Why is that 77 number easy? Because you learned it in a different way. You said it in a different way. So so these are some of the tips. Then also have a memory, emotion to each memory, because we know that the center for emotion in the brain is also closely related to the memory center. So if you have memory to with each memory, if you have an emotion, you'll tend to remember it better and for longer. And I don't think I need to give an example. So about this is something that you learned as a child. It will come back to you, from your long-term memory in a fraction of a second, as opposed to what happened, say, last night or this morning. You may need to think a little bit about it. So these are some of the tricks and techniques about it. Sleep is of paramount importance. As we recharge our phone batteries, there is more emphasis on more research these days. When you're sleeping, your brain cells are getting recharged. It's like the same analogy of charging a mobile phone or any device. And they say that there is a like a different drainage system of the brain called glymphatic. So they kind of clear out all these memories and flushing out all the toxins and stuff like that. So during the second half of the sleep, you if you have a restful sleep, you'll tend to remember the memories, or it will be beneficial to the memory. Is yeah, the quality and quantity of sleep. So what may apply to for a person, everybody's need is different. So if somebody feels refreshed in 4 hours of sleep as opposed to 8 hours, so 4 hours is for that person. So there's no one formula that we say it's written in stone that 6 to 8 hours is a must. But that's a general advice. But if 4 hours is good enough for you, then have your 4 hours. But it should be undisturbed. It should be refreshing asleep. You should not feel tired the next morning. and also the amount of tea, coffee you consume, smoking as well as alcohol, because they also affect the sleep, the physiology of the sleep. And as I mentioned earlier, sleep apnea is one of the condition where you tend to snore a lot, and there is lack of oxygen provided to all the organs of the body. In this case, the brain. So if you have sleep apnea or you snore loudly that you feel tired the next day, you nod off and things like that, you must see a doctor immediately, either a neurologist, a neuropsychiatrist, or a chest physician to diagnose that condition and treat. It is a treatable condition, sleep apnea.